The numbers are pretty grim, 400 people overdosing from fentanyl and dying in Alberta between January and September of 2017. That's a 40% increase over the same time last year. We're attacking this from every single angle that we can, but it keeps rearing its ugly head. Alberta Health Services, AHS, Medical Health Officer Drive. Nick Etchell said. Read more, 3 to 4 people die every day in Alberta from opioids, Calgary Police Chief. But the situation isn't black and white. Neither is the solution. There have been some significant steps taken over the past year to try to gain the upper hand in the fight against fentanyl. A safe injection site opened in Calgary in November with nearly 1,000 people accessing it in the first month. Read more, supervised consumption site approved for Calgary's Sheldon M. Chumere Health Center. The province has made access to the antidote naloxone free and easy. Anyone can pick up a naloxone kit at almost any pharmacy or walk-in clinic by simply asking. People don't have to provide personal information unless they want to. So far, more than 30,000 kits have been handed out and more than 2,000 successfully used to reverse an overdose. Alberta Health Services website also provides in-depth information and tools to prevent overdoses along with treatment options for those struggling with addiction. Etchell admits the crisis isn't getting better, and in terms of fatalities, it's only getting worse. I think it's suffice to say it's not relenting. As a retired doctor, Calgary Mountain View MLA Drive. David Swan has a vested interest in the opioid fight. He believes frontline workers are doing the best they can with resources they have, but that more needs to be done. This is well beyond the healthcare system, Swan said. We need to get a handle on all the mental health issues if we are going to get this. Swan believes we need more collaboration between health and mental health and stronger, more focused leadership on mental health and addictions. Read more, Calgary South Asian Group receives money to fight opioid crisis. Etchell also says there are holes in the system. The main issue is just making sure that the different types of care that are available are all connected with one another. And with a large variety of service providers we have in the province, that can be a challenge, but I know it's been actively worked on. Swan is also pushing for accountability on both the provincial and federal levels, calling for more openness and clarity about where the millions of dollars committed to combat the crisis are going. Alberta health officials say one of the biggest misconceptions about the fentanyl crisis surrounds who is fatally overdosing and where. It's not only avid drug users falling victim, and most deadly overdoses aren't happening on the streets. According to the latest Alberta health statistics, 67% of fatal opioid overdoses happen at the person's home. Read more, Calgarians demand action to stop spike in fentanyl deaths. Jessica Holtzbaum lost her older brother, Nathan, to a fentanyl overdose. He became addicted after a doctor prescribed him opioids to ease the pain from a back injury.